Hi, I'm Dr. Jen. I'm a board certified fertility doctor, and I'm here to talk about 3 reasons you may want to do IVF as opposed to IUI. Can you see and hear me on YouTube? Okay, give me a minute while I get set up here. So I'm Dr. Jen. I'm here to talk about 3 reasons to do IVF as opposed to IUI. And so I will talk about that. Then we will go on from there. So give me 1 minute just to get this all set up here. So thank you. I hope y'all can hear me. I'm Dr. Jen. I'm here to talk about 3 reasons why you may choose to do IVF as opposed to IUI. Let me post a comment here. Thank you to everyone who joined. So I'm going to talk first, and then I will take questions at the end. So thank you, everyone, for coming out tonight. Let's see. Let me see here. Okay, so I just posted a question, so feel free to respond if you would like and ask questions. So today I'm going to talk about a question I get all the time is, when does IVF make more sense than IUI? This is important because IUI can be a great option. It is less invasive, less expensive, and may feel like a gentler first step. But there are situations where IVF can give you a significantly higher chance of success. And if you're continuing IUI, that can actually cost you time, money, and emotional energy. So I'm going to walk you through 3 common reasons why IVF might be better choice than IUI. And this is always general education. Every situation is very individual, but this is general education overall. So again, talking about when IVF may make more sense as opposed to IUI. So the first reason, I'm going to go through 3 reasons. The first one I want to give is having multiple IUIs that already failed. So if you've done multiple IUIs, let's say 3, that's the most common number. If you've tried 3 and you haven't gotten pregnant, that is a good time to consider moving on to IVF. In general, IUI success rates per cycle are, I would say, modest. So if you're doing fertility treatment because you're having trouble getting pregnant, let's say you haven't been able to get pregnant on your own for over a year, your chances of pregnancy per month go down to less than 5% chance per month. So IUI can double that, sometimes a little more than double, but you're looking at still single digits to like 12% chance of success per month per cycle. And that's good for IUI, but it's not like 100% chance per cycle. It's much lower than that. And that's in general why we say if other factors are normal to try 3 IUIs, because it can take 3, after 3 tries, then your chances are getting up near 40% or higher. And then they start to level off after 3 to 4 tries of IUI. Most people will get pregnant who are going to get pregnant in those first 3 cycles, maybe 3 to 4. But after that, it kind of plateaus the success. So you really want to consider moving on to something that has higher success rates, which is like IVF. So for IVF, for tested blastocyst has a pregnancy chance of 50% each one. So it's much higher chance of pregnancy than IUI is. And so basically, if IUI is not working after 3 or 4 times, sometimes you can change medication, but in general, you're not going to boost that success rate much. So you want to move on to something that works a lot better for you. IVF, it can bypass your fallopian tubes. It allows us to know that the eggs fertilized and grew into embryos. So these are reasons that it can work when IUI hasn't worked. And it also gives us a lot more information about your eggs and your embryos than IUI does. So that's reason number 1. So today I'm talking about 3 reasons you may want to choose IVF as opposed to IUI. So the first one being that that after 3 tries of IUI, you may want to move on to IVF. So if you've done 3 IUIs, that's one reason. The second reason is over the age of 40 or low egg reserve. So generally, because the IUI success is not at that high per month, as I was saying before, it can be like 10 or 12% per month. That when you're age 40 and above, you don't have a whole lot of time because your egg reserve is rapidly decreasing your quality and your quantity of eggs, that if you I don't want to say waste time, but spend a lot of time doing IUIs, you can really see a big decrease in your natural fertility during that time. And that's not ideal when you're over age 40, because time is really of the essence. It's so important to do the most successful type of treatment, which is IVF. This is especially true if you have low AMH, because that's another sign. In general, women over age 40 will have lower AMH, but if yours is, say, lower than expected for your age, that can be another reason, because that also means your egg supply is low and it just gets worse with time. So you don't want to spend a lot of time doing treatments that are not as successful. So that is reason 2 if you're over age 40 or if you have a low AMH. So, another thing about IUIs is releasing in general 1 egg at a time, sometimes more than 1 egg, but usually 1 egg at a time. And we're relying on that 1 egg. We're relying on it to be released, the egg and sperm to meet on their own in the fallopian tube, for it to naturally fertilize and fertilize properly, and for it to be chromosomally normal. And you get that 1 chance in general, sometimes more than 1, sometimes 2 eggs will grow in an IUI cycle. But with IVF, you can get a whole group of eggs to grow, and then you'll be able to retrieve more than 1 egg in the cycle. You see which eggs fertilized, you'll know about embryo development, and you can check the embryos to see if the chromosomes are normal. And then if you have a chromosomally normal embryo, not only does it have a higher chance of pregnancy than one cycle of IUI, but it also has a lower chance of miscarriage. So because most miscarriages happen because of problems with chromosome number in the embryo. So if you have a normal, a chromosomally normal embryo, you have a lower chance of miscarriage too. So that's another benefit. And I will mention that for IVF protocols over the age of 40, it's very important to personalize your protocol. Older high-dose protocols aren't always the best approach for women over age 40. You want tailored, personalized stimulation protocols. Those are really going to work a lot better if you have low AMH, if you're over the age of 40. Just in general, they also work better because they'd be personalized to you and your body and your eggs, but it's particularly important for low AMH or over the age of 40. So today I'm talking about 3 reasons you would choose IVF over IUI or continuing to do IUI. So number 1 is if you've already done 3 IUIs. Number 2, if you're over the age of 40 and or have low AMH. And number 3 is severe male factor. So if you have significant sperm issues, then IUI will not work well. So in that case, I would choose IVF first. So with IUI, you want a really good number of sperm that are moving well. So you want 10 to 15 million motile sperm. And you want them to be normally shaped as well, because they have to go and fertilize the egg on their own. So if you have problems with the sperm count, it's lower than that, or the movement or the shape of the sperm, then IVF is a good first choice, especially if the sperm count is very low, or there's no normally shaped sperm. That will make the chances of IUI working to be a lot lower. So in that case, you want to consider doing IVF first. So with IVF, the embryologist does something that's called ICSI, where you take one sperm and you inject it into the egg. So that allows like a healthy, they pick the sperm that's sort of swimming the best, that looks the best in appearance and is swimming the best, and that's the sperm they inject directly into the egg. So that helps fertilization. Unfortunately, it doesn't guarantee it. Even with ICSI, not 100% of eggs will fertilize, but it helps fertilization. So it takes that factor out that's unknown in IUI. We don't actually know if the egg and sperm fertilize, and we can document and confirm that fertilization has happened. And with the lower sperm counts, then IUI is going to be less successful, because you really need that high number of sperm to have a good chance of success with IUI, which again is about 10 or 12% per month, and that's with a medicated IUI cycle. And this is specifically for couples who have been trying and not able to get pregnant, say for a year if you're under 35, or 6 months if you're over 35. So same-sex couples would be expected to have a higher pregnancy rate per cycle with IUI, because there's not an issue with fertility specifically. So male factor is common, but it's not discussed as much, I feel like, as much as egg quality is. So it's an important factor to consider. And IVF can work really well, even for severe male factor. So it's a great treatment option. So I'm Dr. Jen, and I'm here today to talk about 3 reasons why you may choose IUI over IVF. So the first one is if you've already done 3 cycles of IUI and you're not pregnant. The second one is if you're over age 40 and or you have low AMH or low egg reserve, you would want to consider doing IVF before instead of IUI. And then the third reason is for male factor, especially severe male factor, whereas if the total moving sperm are too low for IUI to work, then you would want to not spend your time doing something that has a low chance of success, but move directly to IVF. So those are 3 common reasons, not all the reasons for IVF. There's more reasons why you may choose IVF first as well. For instance, like recurrent miscarriage is another reason. But those are 3 common reasons why you would choose IVF as opposed to IUI. So it doesn't mean that IVF is the right first step for everyone. IUI still definitely has a role for many people, and it can work beautifully for many people. But it's about making sure you get the treatment that's the right fit for you. Um, and If this is you, you should talk to your doctor, your REI, about whether a continuing IUI cycle still makes sense for you. So if this was helpful, please follow along, tap follow. I do a lot of lives and break down fertility decisions like this a lot in my lives, and I always take question and answers as well. So let me get to some question and answers. Let's see here. Okay. So let me look through, and I'm specifically taking questions about IUI as opposed to IVF tonight, so that should cover a lot, but let me go through and see here. Thank you everyone for joining. Oh, okay. So Alexa says all 3 and all failed moving into IVF. Okay, so that is the right decision, I would say, without knowing more information. So that was the number 1 reason is if you've done 3 IUIs and you're not pregnant, IVF works better. So good luck with your IVF cycle. I did 1 IUI and it failed. I hear it's like timed intercourse. This is from Tina. IUI is different than timed intercourse because we should clarify about the type of IUI, I will say, because there's a lot of different ways to do IUI, but medicated IUI, so if you take a pill like letrozole or Clomid for 5 days, and then take a one-time injection, Ovidrel, and then do IUI timed to your ovulation, that will increase your chances above timed intercourse. But again, it is something that you may need to do for a few cycles before it works. So don't get discouraged from 1 failed IUI. But if it's not working for you after 3 times, 4 times, that's when you want to consider changing your treatment. Okay, and Zizu says 2 failed medicated IUIs, went to IVF, success in the first cycle. Congratulations. Yes, IVF success rate is much higher than IUIs and will work even if IUIs have failed, or can work even if IUIs have failed. And Maya, if I'm saying this right, Maya asks, can I ask about multiple miscarriages? Yeah, so that can be a reason to do IVF as well as multiple miscarriages. And this is because miscarriages, the most common reason that they happen is because of chromosome problems in the pregnancy, so abnormal chromosome number. And if you do IVF with, and check the embryos with a test called PGTA, you can see which of your embryos have the right chromosome number and which are abnormal. Then you would transfer only the embryo that has the normal number of chromosomes, and that will decrease your chance of miscarriage. So it can be a good option if you've had recurrent miscarriages for that reason. I want to try IUI with my husband, but we did a semen analysis and it showed clumping. So the sperm clumping together. So the sperm that you use for IUI is a wash sperm. So the sperm basically it's almost like a swim test, not exactly, but it's a wash. So only the sperm that are swimming really well will make it through the washing basically. So even with clumping, as long as the total motile count is there after, like the wash would take away the clumping and only leave the ones that are moving well. So you'd want to check what the sperm count was after the wash to make sure it is still good for IUI, but it could be an option still. Okay. How do I feel about mini IVF with DOR? This is from Dog Lover. Thanks for your question. So yes, so mini IVF, so mini, or I like to call it personalized IVF, is very good for low egg reserve, because with low egg reserve, your FSH levels are naturally high. So high dose IVF, heavy medications, does not work as well when you have low egg reserve or low AMH. So you want a personalized approach, which is more aligned with mini IVF, but I like to call it personalized IVF. Okay, Albus says, after 2 miscarriages, should I do baby aspirin and CoQ10? You'd want to get a check and see why you're having miscarriages, rule out like a uterine shape problem, a clotting factor problem. So I'd start with that first so you can get answers into why you're having miscarriages. And you do IVF if you're pre-diabetic. So IVF is collecting the eggs, fertilizing them, and then freezing the embryos. So you can do that. What you want to do before you get pregnant is make sure that your hemoglobin A1C, which measures your blood sugar control, is good before you get pregnant, though. But I've had some patients who maybe they're over age 40 and they need to work on getting their blood sugars under control. But during that time, they're really losing their fertility. So they may collect eggs and freeze embryos, but not get pregnant immediately while they work on optimizing their health. Can you talk about IVF success with DOR, decreased ovarian reserve, above age 38? This is Tina. Yes, so I have a lot of experience with low egg reserve and IVF above age 38. So it will, I would say often with low egg reserve at age 38, 39, 40, in my hands anyway, most women would get pregnant still. Once you're over age 40, it depends somewhat on your AMH. And the thing to know with low egg reserve is sometimes it can take more than one egg collection cycle. So more than one egg retrieval to get basically the good egg, the egg that can grow into a pregnancy. At 38, sometimes that can happen too if you have low egg reserve. So it doesn't mean it can't work, but it can take more work. Let's see. So what are the chances for success when one tube is completely blocked with the IUI? So it can still work. It's probably the success rate is a little lower with a blocked tube, and you're at higher risk of having an ectopic pregnancy where the pregnancy could get stuck in that tube basically. But it can still work because even if the egg ovulates from the ovary where the blocked tube is, the other fallopian tube can pick up that egg. So, it can still work with a blocked tube. And let's see. We're going on a year of secondary infertility currently during our first medicated IUI. Okay, good luck with your IUI cycle. Okay, I just had my first egg retrieval PCOS in age 40, only 7 fertilized, and I'm not feeling confident. 7 fertilized is not bad at age 40, and you only need one good one in the end. So as long as you get one, that's a viable embryo. That's what you need to get pregnant. So, okay. So I'm Dr. Jen, and today I'm talking about 3 reasons why you would do IVF as opposed to IUI or move on to IVF. So if you have any questions sort of about that, that's what I'm focusing on tonight. So let me know if you have any questions. So Mrs. H said, hi, I've had 0 fertilization on 2 rounds of ICSI. Is there a way to change this? All tests are fine. Without knowing your full details in your history, I couldn't give you very personalized advice, but in general, if the eggs are not fertilizing with ICSI, you want us to look into egg maturity, make sure the eggs are mature when they're being collected. You want to look into sperm quality and make sure that is optimized as well. Let's see. Kate and Marie says, I had 2 dominant follicles from letrozole this cycle. Okay, yes. So that means like 2 eggs grew in response to the letrozole. So with IUI, it is important to note that there is a higher chance of twins because of situations like this. Naturally, your body will allow 1 egg to ovulate, but with medicated IUI, 2 eggs is more common. So the chance of twins is increased, especially when you have 2 dominant follicles. That being said, that the most common thing to happen with 2 follicles is just that one would take, but you do have an increased chance above like what your natural fertility would be for twins. It's increased with medicated IUI cycles. So can I expect a euploid? This is from Singing Pug Lady. Can I expect a euploid from 7 fertilized eggs at 40 with an AMH of 4.9? So yeah, so with 7 fertilized eggs, and the next step is they have to grow to blastocyst. So you would expect half or maybe sometimes a little less than half to grow to blastocyst. So let's say 3 or 4 would grow and be tested. And out of those, on average, maybe 1, sometimes you get more than 1, can be euploid. So yes, you could expect 1 on average. So I did IUI and my wife did IVF, and we ended up getting pregnant together and having the same due date. Okay. So congratulations. I don't know if you're still pregnant or had the baby yet, but that's is very cool. What are the chances of IUI being successful the first time? If all other factors are normal and you're doing a medicated IUI with an injection Ovidrel, and then the IUI, your chances are on average going to be 12% per cycle. Okay. Let's see. Is 1.61 a decent AMH for a 44-year-old? Yes, it is. Would you recommend transferring a mosaic embryo? It's possible. I actually have a whole video on that, so check out my reels and follow me for more. I actually think I have a few videos on that. Let's see if they pick the best one. Why does anencephaly happen even with IVF? Okay, this is something important to talk about. The testing on the embryo doesn't check for health or disease. So it really checks only for, is this embryo likely to be viable and grow into a pregnancy? It doesn't check for disease. There's a few chromosome problems it picks up, like Down syndrome, but it's not a check that the embryo or pregnancy or baby is healthy. Unfortunately, we wish it was, but it checks chromosome number and viability, not health. Conceiving with a low AMA, I think you mean AMH level. So yes, so I would say conceiving with a low AMH level, you just want to move through all the steps and keep at it, because even with a low AMH, you can get pregnant because it's not telling you about egg quality. But what you want to be careful of is spending too much time at each step and not sort of moving through the steps of fertility treatment, because time is not on your side. But so I would say if you know you have a low AMH and you're not getting pregnant, go into the fertility doctor sooner and start treatment sooner. Is 18 million sperm count too low for successful IUI? No, 18 million should not be too low, but double check that what happens after the wash, because when I'm talking about 10 or 15 million total moving sperm, that's after the sperm's been washed. And I've had some cases where the sperm doesn't wash well, and so the count is much lower after the wash. So just double check on that. But overall, 18 million total moving is good. So I'm Dr. Jen, and I'm talking about 3 reasons you would move to IVF as opposed to IUI, and answering questions about that. Okay, let's see. Okay, Hannah Bear says, I have no understanding of fertility issues, but my husband's count came back lower than normal. That's really common. I see that a lot. That's why it's always so important to check a semen analysis. So I'm glad that you did that. And then you want to check with his doctor about ways that you can optimize the sperm, because that could be a reason for low fertility as a couple for sure. Male factors not talked about enough. Okay, yeah, that's true. Both IUI attempts only focused on my eggs. Well, no, we should talk about male fertility more. And I feel like we did talk about it a bit during this live, but it's true. Absolutely. I mean, that's one of my 3 reasons for moving on to IVF is male factor fertility, because IUI does not work as well, I'll be honest, for male factors fertility issues. IVF in general will work better for male factor. So thank you for all your questions. What do you think of people going to foreign countries for IVF? I think, in my opinion, the IVF labs in the United States are some of the best in the world. So I would just be careful to check on the lab and their outcomes. And I'm not sure there's mandated reporting like there is in the United States, where IVF labs have to report their success rates to the government. So that is what makes me a little bit nervous about just recommending to go to a foreign country for IVF. Let's see. Okay, so Megan says, I was told my tubes are open yesterday after my HSG. What would our next step be? So I would definitely try to get pregnant because when you do your HSG, that's a test that pushes dye through the tubes to make sure they're open. The benefit is it also increases your fertility, probably because it flushes out mucus. So pregnancy rates go up in the few months after HSG. So I don't know anything else about your history, but I would say definitely try these next few months to get pregnant, whether that's naturally or with IUI. If your partner's sperm count, if you have a partner, if you're using a sperm donor, if the sperm count is good. Okay, let me answer some more questions. I'm Dr. Jen. I'm talking today about 3 reasons that you would move to IVF instead of doing IUI. And again, just a summary for those that just joined. If you've already done 3 cycles of IUI and you're not pregnant, if you're over the age of 40 or have low AMH, that's another reason to move to IVF instead of trying IUI. And the third reason is male factor. So low sperm counts, abnormally shaped sperm. This is a reason to move or do IVF as opposed to IUI. Let's see. Okay. Okay, first beta this is from Triplet Mama Forever. First beta 167 and second beta 2 days later was 491. Could the embryo have split and I have twins? It's possible, but it's not very common. Even with those beta levels, I see usually we say it should about double, and it's more than that, but possible, but not very common. Let's see. Gabriel says, I had 5 blasts sent to PGTA, so that's a test that checks for chromosome number, and I'm 29, so thank you for adding your age because that's always super helpful and should most be normal. So the thing is with how eggs fertilize and grow, that even when you're young, even when you're in your 20s, not all the blastocysts will come back normal on the PGTA. I almost never see it. The good news is you should have maybe even more than half that come back normal, but it's likely that you'll have some that will come back abnormal, even when you're in your 20s. Just lots of mistakes that happen in the fertilization process, basically. Let's see. Is that also called an SAS? Mrs. Morgan says, I'm not sure what that was referring to, but the SIS is a test where saline is put in the uterus, and we do that before an embryo transfer. The HSG is where dye goes through the tubes to check on the fallopian tubes. That's recommended before IUI. And here's one that just popped up. Fran finds, how about someone with hydrosalpinx? Well, hydrosalpinx, that's what you would find on HSG, what we were talking about, which is an x-ray of the fallopian tubes. That means there's fluid in the fallopian tubes. So in general, IUI is not going to work as well because the egg and sperm aren't going to meet in a hydrosalpinx tube and fertilize. So then you may be considering more IVF. And even with IVF, that infectious fluid in the hydrosalpinx can link back into the uterus. So sometimes you have to remove that before an embryo transfer. It says stims start first week of February, and my AMH changed from 21 to 28. So I think that's, I'm not sure if you're in the US because the AMH levels are measured differently in different countries, and they lowered my doses. What causes the jump? Honestly, it's probably just a shift in this isn't like a perfect measurement of hormone in the lab. And sometimes you'll see little shifts like that just due to the lab. And it's probably nothing that's exactly going on in your body. Okay. Aegis is what I recommend another SAS, so that's a check on the uterus after 2 back-to-back retrievals. You did one before the retrievals. Generally, if you do that saline sonogram to check the lining of the uterus, it's good for 6 months or 12 months. You don't necessarily have to repeat it. Today's day 8 post-embryo transfer, but still negative pregnancy test. This is from mom of 3. Does it mean no? Not necessarily. Day 8 can be a little early to test after an embryo transfer. Usually I like to wait 10 days so that I can be more confident that I'm getting a true positive or a negative, because 8 days after it can be a little bit too early. Boy Mama says, does letrozole help the egg mature better than normal ovulation? Possibly. Sometimes the egg can get to a bigger size with letrozole. I've seen that in some of my patients. So yes, in a way it can help the egg. It can balance your hormones, so it can help the egg mature better in some women. Okay. What are the chances of a natural conception after a uterine septum being corrected? If that was thought to, this is from Haley, if that was thought to be the main issue for your fertility, then you have a good chance of getting pregnant after correcting that. Let's see. Eva says, my fallopian tube is blocked, and how successful is surgery to unblock it? It depends where the blockage is. If it's up closer to the uterus, sometimes that can be opened, but in general, it's very tricky to open and keep the fallopian tubes open, because when you go in to do surgery to unblock it, you can open it at that time, but a lot of times they'll just close back after the surgery. So in general, problems with the fallopian tube, that's another big reason that could have been on the top 3 of why to do IVF, but issues with the fallopian tube, like fallopian tube blockage, is a big reason to do IVF, because unfortunately the repairs are not that successful. Okay, I think I got most of your questions, but Dr. Jen, I'm talking about 3 reasons to do IVF. As opposed to IUI. So thank you for all your questions. What's the success? Marta Elizabeth says, what's the success rates of IVF after 3 chemical pregnancies? Well, IVF can work well if you're having issues with chemical pregnancies, because we can screen the embryos for chromosome problems, which is the most common reason for the chemical pregnancies. So IVF can work well for that reason. Let's see. Okay, I think I've gotten to most of your questions, so thank you so much. Let's see. You just said, what causes a chemical pregnancy, I think is what you mean with the day 6555 AA euploid. First beta was 117 and then 91. So definitely you want to follow up on that. Usually we don't diagnose it just based on one beta that's low, but it could be a sign of a chemical pregnancy. And that can happen because the chromosome testing test the big chromosomes, but there can be small chromosome problems. Sometimes if there's polyps that were not treated, that can cause a chemical pregnancy as well. So those could be possible reasons, but I would say definitely follow up on it to make sure you know what's going on. What's the difference between mini IVF and regular IVF? Regular IVF is like an older way to do IVF, where you take heavy doses of injections. So it's a common type of IVF that a lot of women know about, where it's very heavy injections. Mini or personalized IVF checks your hormones and it gives you a more personalized dose of IVF in the right hands. Traditional mini IVF is just much fewer injections, but there's sort of a newer way to do IVF, which is personalized. So you get just the right combination of pills and injections that's just right for you and your eggs. And that tends to be a lot fewer injections than the heavy, high dose, older type of IVF that's done. But generally, it means fewer injections. Okay, let's see. Haley says, can suppositories cause spotting and cervical irritation in IVF pregnancies? Yes, that's very common. I see that a lot. The progesterone suppositories can irritate the cervix, and that can cause spotting. That is very common. Okay, it's Thor says, I have 14 retrieved, but none made it to blast. What is missing and why? So I would definitely check sperm in this case and make sure that nothing can be done to optimize the sperm, because the sperm plays a big role in whether embryos make it to blast. So that's something to consider. Tina, euploid rates for 38-year-olds with DOR, a little bit depends on what your DOR level is, what your AMH level is. Euploid rates in general at age 38 are, I'm going to say 20 to 30% maybe. So yes, with lower egg reserve, you can get euploid embryos, but it can take more than one egg retrieval. That could be common because not most embryos are euploid. So thank you for all your questions tonight. Stay tuned. Please follow my channel. If you like content like this, fertility guidance and question and answer sessions, I do weekly lives and I'll post them on my channel. So follow along for more lives like this. And thank you everyone for joining.